Good day. You are welcome once again to the continuation of our sessions regarding the club members training on COVID-19. I'll be taking you through section 9, where we'll be discussing safety tips during sports events, as well as some of the things to consider around the sporting facilities while you are going to have your events, and what are the things to consider, and so that you can be able to minimize the risks of contracting the virus or of a participant giving it to another participant. Planning is one of the most important things that one needs to do as a sports manager, administrator, an athlete when they are going to an event or they are going to participate. Especially now that the coronavirus has come, a lot of things have to be put in place as well at every facility so that they can be able to accommodate all the rules and regulations that have been provided by government and as per recommendation from the World Health Organization. I'll be taking you through this section on various things that one needs to consider, and we'll be breaking them down. Now, what are some of the things that one needs to consider? There are 5 things that you need to consider in terms of going into an event or when you are going to a sport facility. Number 1, you need to consider whether this type of event is a high or a low risk event. Number 2, you need to consider the size of the event. Number 3, you need to consider the venue or the facility that you are going to be participating at. Number 4, you need to consider the demographics of the participant. Number 5, you need to consider the risk communication. I'll be breaking down all these 5 factors or the 5 points for you so that you can be able to understand what each point entails and what it means. Now let's look at the first point, which is consideration of whether the event is a high or a low risk event. What are some of the things that one needs to do? Now, what do we talk about when we talk about low risk events? These are events that are more prone to be participated by individuals, such as golf, such as shooting, and any other sport that does not require a group or a team to come together. What are some of the high risk events? These are events that are basically based on teams and groups. So if we look at an example, we look at rugby and we look at soccer. So why is this high risk and why is the other one a low risk? Due to the fact that one has participants that are participating individually, so they don't have to go and be making a lot of contact with other participants. Rugby and soccer will be considered as a high-risk event because lots of the players will obviously have to come into contact with other players. They will be going into contact all the time during their field of play or during their sessions. Now, what are some of the things that one has to consider in terms of this type of high or low risk event? What are the mitigations? Number 1, you need to ensure that you do daily checks before you go into it to participate. Number 2, we need to ensure that we maintain our social distancing of 1 meter per person. Number 3, we need to ensure that the places that are going to where the event is going to be played is disinfected. This can be ranging from the equipment. This can be ranging from cloakrooms, can be ranging from any other place where the athlete will be participating, sitting and sharing space with others. Number 4, one of the things that we can consider is things where athletes don't have to be sharing equipment and they don't have to be sharing bottles. Just to say that recently, as I've mentioned in my previous clip, that I've had the chance to visit some of the PSL clubs and rugby team practices, and I did see all the protocols that they followed, and they were very compliant in terms of every player, when they come every day, they need to be to ensure that whatever equipment they are going to use, they will be disinfecting it. They will look at the balls that they're going to use, they will disinfect them, they will ensure that the bottles are put aside. So these are all protocols that one has to take, especially if you are dealing with a high risk event. Now, what is the second thing to consider? As we've mentioned that you need to consider the size of the event. What are the things to consider in this case? The physical distancing of the spectators. Recently, we've seen that a lot of the football matches, soccer matches, most of the events do not have participants with them when they are playing. This can be attributed to the fact that a lot of the events that are happening now, most of the team or event organizers are trying to ensure that players are not really coming into contact with each other off the field. We've seen in most of the games that even the way that the players walk out to the pitch, they try to maintain a social distance. Those who are sitting on the bench are sitting separately from each other. In saying this, we need to ensure that when spectators do come to the events, they are very well screened, that they maintain their social distancing, that they are wearing masks, and to ensure that they do not come into contact, especially with the players, because we don't know which underlying conditions some of these players, spectators have. So in terms of the size of the event, one doesn't have to really worry much if the event is a low attendance event. The worry will only come in when it is a event that is attended by a lot of people. So there still needs to be some form of precaution, but currently we have seen, and it is evident, that a lot of the events do not have spectators. What are some of the mitigation factors to look at in this circumstance of the size of the event? One can look at putting aside designated seat for the spectators and the players. Some of the seats you can mark off and say you cannot sit here, you can sit here, so that they can be able to distance themselves from each other. One of the things that one can consider in terms of the following is to ensure that there is screening of temperature at the entrance or at the gate, or even through in the cloakrooms. We've seen now a good example in the PSL that whenever a bus stops, all the players come out. They are screened just before they go into the cloakrooms to ensure that none of them, their temperature is above 38 degrees. So this is a very good measure to put in place, because should anybody be seen or find that they have a high temperature, the situation can be dealt with immediately. The third thing to consider is the event, whether is it an indoor event or is it an outdoor event. So this is very important, because when you have an indoor event, you need to ensure that there's enough ventilation for everybody who is sitting in there, in the hall or in the closed up space, to ensure that they can be able to get enough air. When it is an outdoor event, it makes it a bit easier, because outside there is enough ventilation and there is enough air and there is enough room for everybody to breathe. When we look at the venue and the facility, one must also consider whether it's indoor or outdoor, that does it comply to the current regulation of COVID-19. Some of the mitigation factors to look at here is the fact that does it have space for self-isolation for people with symptoms? So should somebody be coughing, be sneezing, should their temperature be above 38 degrees, does the event have a place that is placed outside or within the facility so that the person can go in there and be self-isolated until they can receive the required help? So these are some of the things that one can look at. Within the venue and the facility, do we have medical trained staff? Are there nurses? Is there somebody there who is a professional that can help from a medical point of view? These are things that need to be implemented at the venues. The first thing to look at is the demographics. When you come to an event, you need to consider that. Who are my participants? Who am I going to deal with? How old are they? Are they younger? Are they older? We know that in most of the teams, that a lot of the coaching staff, personnel, administrators, most of them tend to be people that are very old. But the participants tend to be younger than the coaching staff and some of the background staff. So what are some of the things to consider in terms of these demographics? One has to check and make sure that these people or the coaching staff does not have underlying conditions. Recently, in one of the teams in Europe, most of the elderly coaches did contract the virus and they were able to be self-isolated. So this is where one must be very careful and determine and pre-screen and make sure that you go through every process to ensure that more elderly people are not exposed and are not going to contract the virus. What are some of the mitigation factors to consider in terms of the demographics? Now, one has to look at whether the person has currently traveled. One has to look at whether the person has currently been experiencing various symptoms. Are some of these people currently on any type of medication that they are taking? So these are some of the things that one can consider in terms of looking at their demographics, the age and the health of all participants. Now, the fifth thing to look at is the risk communication. One of the things to consider is the fact that you need to be able to communicate to the public health to advise before and during events to everybody. Some of the mitigation factors to consider in terms of risk communication is that one needs to ensure that they have signs to inform spectators on how they can protect themselves from the virus. Recently, I went to a facility where everything within the sport stadium, from the entrance through to where you go into the field, through to where you go to the office, they've placed a sanitizer there, they've placed signs, they've placed everything that you need to know about the virus so that when you are there, you need to know what to do. All the information is provided in terms of risk communication. You are warned to wear masks. You are warned to always wash your hands. You are warned never to come into contact with other people. You are warned to maintain your social distance. So all these are the risk communication factors that one can consider and give as a tip to other members. Now, we are going to look at some of the recommendations that can be provided. Number one, to event organizers, what should be done prior to the event and during the event. Number two, we are going to look at some of the tips and recommendations to participants when they are going to participate in an event. Now, what does one do pre-event and during event? Before the event, one needs to ensure that they have the availability of hand wash or local-based hand wash in a facility and every accommodation. Two, they need to ensure that they've got good hygiene signs for everybody to know what needs to be done. Number three, they need to provide medical help, first aid assistance, nurses, so they can refer to these cases of people who have a temperature of about 38 degrees Celsius to the medical personnel. We also need to ensure that there is capacity to accommodate people that have the virus or people that need to go into isolation. We need to ensure that there is rubber gloves for those handling laundry, towels. Single usage of towels is recommended because people should not be sharing towels. People should not be sharing hand washes. Number four, we need to ensure that we have thermometers that are there and a recording sheet for every participant that comes in or before the event. We need to ensure that contacts of where the person who has contracted the virus will be isolated or quarantined. We need to ensure that there are disinfected wipes and regular cleaning of doors, toilets, and bathrooms. We need to make prevention packages for athletes during the event. Small towels, hand sanitizers, thermometers, wipes, disposable cups, medical masks, and many others. All this information can be found in the manual on page number 109 and page 108. So in saying that, what are some of the recommendations that one can give to the event participants? We've just dealt with what the organizers can do. Now we are going to look at what the athletes themselves need to do to ensure that they prevent themselves from this virus. What must an athlete or a participant do pre-event precautions and tips and safety measures? Number one, they must regularly check their health status by taking temperature and by looking out for symptoms that can lead or can be a sign of the virus. Now, during the event, safety tips that participants can do, and this can also include coaches, this can also include background staff, is to number one, take daily temperature readings. Number two, they're encouraged to wash and sanitize hands regularly. Number 3, they need to cover their mouth and nose, especially when sneezing. Number 4, they need to avoid contact with sick people. Number 5, they need to avoid contact with anyone if they themselves are ill or if the other person is ill, as we have mentioned previously. Number 6, we need to ensure that they do not share towels, they don't share clothes, they have their own bath soap and other personal items that belong to them and not share it with their teammates. Number 7, we need to ensure that they have their own water bottles that are labeled and washed after each session. And we have seen this throughout many of the events we've seen currently, that athletes have their own bottles and do not share bottles during water breaks. They must ensure, number 8, that they avoid hugging. Number 9, they must ensure that they avoid steam rooms and sauna rooms so that they cannot be able to attract the virus. In saying this, all the information can be found in our manual, and I believe that these tips can assist and help us in ensuring that we do not spread the coronavirus amongst ourselves, as teammates, as staff, as colleagues. For any further information, as I've said, you can refer to your manual on page number 111 and 112 as well. I believe that you will be able to go through this and get more insight and understanding. And if there are any other questions, I believe and hope that this can be addressed in our Zoom sessions where we'll be contacting each other. I thank you.